So what about us? What about Canada and the United States? Well, we'd probably be classified most accurately as a semi-restrictive sexual culture. Now, would most parents prefer their children, both boys and girls, but especially girls, to not experiment sexually before being in a committed, hopefully lifelong relationship? Absolutely yes. But parents are not stupid or naive. And our society is not the same as it was 100 years ago, or 50 years ago, or even 25 years ago in the 1980s when I was in high school. Adults are fully aware that adolescents are much more sexually active than they have been in the past. That's a fact. And to me, the best example to demonstrate this is the development and the widespread acceptance of hookup culture, where two people are together sexually with the understanding it's for sexual purposes and nothing more. So not only has hookup culture emerged, but it's widely accepted by adolescents, whether parents like it as or not. In fact, it really has become the normative form of intimacy on college and university campuses. Parents and other adults might prefer this wasn't how society had evolved, but they focus instead on encouraging safe sex, realizing our society has changed. So this is not unusual. It's not the absolute norm, but it's not unusual. For a parent, for example, to automatically take their daughter to the family doctor at 16 or 15 or even 14 to have them put on the pill, which demonstrates that they expect their daughter to be sexually active during her teen years. So in some ways, sexuality in our culture and our society has changed quite drastically, even for adolescents, as demonstrated by the fact that they're more sexually active now than in the past, that premarital sexual activity and sex is more accepted, and this is demonstrated by the casualness of hookup culture. But at the same time, without a doubt, we still have a double standard when it comes to sexual issues. There are still different norms for someone depending on whether they are male or female, different generally accepted rules, different expectations, and yes, even different understandings of sexuality that are likely to be held by somebody depending on if they're a girl or a boy. I already talked about dating scripts, where boys usually have a proactive dating script and girls usually have a reactive dating script. Well, a sexual script is kind of the same thing. It's a cognitive framework for understanding how a sexual experience is supposed to proceed and how sexual experiences are supposed to be interpreted. In other words, what's considered normal and appropriate for somebody regarding sexual activity, regarding if they're male or female. We still have these general sexual scripts, these general expectations for how a male will react and react to sexual activity, and how a female will act and react to sexual activity. And when I give you some examples of the differences in sexual scripts for males and females based on research, to me, it all coincides with our pre-existing stereotypes that still pretty much dominate our society. For example, as with asking a girl out or initiating a goodnight kiss, in general, even beyond a simple kiss, both boys and girls still feel it's normal for the boy to make the first move sexually. This is generally what both expect. It is the norm for the male to initiate any kind of sexual activity, ranging from kissing as indicated, to necking, to petting, to intercourse or oral sex. Our sexual scripts for girls, at least in North America, is that we expect the girl to be the level-headed one. She's the responsible one, the hesitant one, who sets the limit regarding what will happen regarding sexual activity. The girl determines what will be allowed to happen, which, by the way, necessarily implies that if left up to the boy, they would always end up having intercourse, that they would always end up doing everything. This implies that a boy always wants to go all the way, and that a girl is always the one who puts the brakes on. Now, coinciding with this, our sexual scripts also include different understandings of sex and sexuality. And what I mean is that girls have a different understanding than boys of what sex means, what it represents, and what they expect of being sexual with somebody. So when it comes to sexual activity, girls are more likely than boys to include an expectation of romance as part of their sexual script and an emotional connection. This, for girls, is what they expect of sexual activity. Now, is this a stereotype? Absolutely. But it's part of the female sexual script in our society. And for boys, I hope this isn't insulting if you're male, and please remember this is not an absolute statement that applies to every single male. But generally, the sexual scripts of boys focuses more on the purely physical aspects of sex, the sexual activity. So boys and girls, according to our sexual scripts, interpret sexual activity and sex itself differently. They just do. And this isn't a stereotype. Research indicates it's true. As your text points out, this probably has a lot to do with why boys and girls tend to have differing perceptions of their first time having sex. Since a boy's sexual script tends to be focused purely on the physical aspect of sexual activity, having intercourse for the first time is often completely positive because he's completely focused on that. But for girls, they tend to have a different perception of the first time they have sex. Not necessarily a completely negative perception, but certainly not as positive as for boys because their sexual script tends to include an expectation of romance and an intense emotional connection. So for girls, part of what they expect from their first sexual experience is an emotional connection, a fulfillment, which is usually not the case. Now, in part, I blame Hollywood for this, for a very large portion of this, because what we typically see in movies and on TV is a beautiful, emotional, touching experience when two young characters have sex for the first time. It's a life-altering experience, something they almost can't describe in words. And in real life, the majority of the time, that is not the way it is. So real life rarely matches expectations. In fact, real life is often way below expectations, which is disappointing in several ways. And this then, for girls, helps to reinforce the idea that premarital sex is not positive, that it shouldn't be encouraged, especially for girls. If the girl doesn't have an overwhelmingly positive romantic experience, then she's more likely for a boy to question herself and wonder if she should have done it to begin with. So this is like a sexual double standard coming into play again here. And because of this, female adolescent sexuality is simply not as free and enjoyable as a boy's. And I'm not saying that boys have it 100% easy, not at all, but it really isn't quite the same. Boys don't have the same weight placed on them regarding premarital sex. So, we've got all these youth having sex. How responsible are they? Do they use birth control regularly? And if so, do they use it properly? On top of birth control, do they also take the threat of a sexually transmitted infection seriously? Well, we know that there's several methods of birth control and infection prevention available in developed countries like ours. But the question is, how responsible are adolescents when they're using it? Now, yes, both boys and girls can get a sexually transmitted infection. But a lack of protection is going to affect girls more because if a pregnancy occurs, it's just the way our bodies work, that it's girls who are affected physically. And it's girls who are more likely to affect lifelong consequences because of it. And unfortunately, the fact is in North America, most adolescents do not make effective, consistent use of birth control. They don't use it consistently and they don't use it properly. And I admit it's a little shocking to read that only about 60% of sexually active adolescents report always using contraception. That just blows my mind. Why? And I hope this doesn't sound too sexist, but especially for girls, why would you take the chance of getting pregnant? Because the fact is, if a girl has a child when she is young and unmarried, for the vast majority, this will have a seriously negative effect on their life. Yes, there's always exceptions. I've had students who are exceptions to the rule, but we're talking about the majority. An unmarried teen mother is twice as likely to drop out of high school. She's less likely to find permanent employment, less likely to go on to post-secondary education. She's less likely to get married, and if she does get married, she's more likely to get divorced. So knowing that this is the situation for the majority of unwed teen mothers in North America, why would girls take the chance? Well, Diane Morrison looked at this exact question, and she said, according to her answer, it's actually pretty simple. She said that most of the time when adolescents are sexually active, it's spur of the moment. It's not planned. They're not absolutely counting and sure that they're going to be having sex. It just happens as part of the natural progression of things that we talked about earlier, with necking to petting to intercourse. So in the moment, if they have condoms there, they'll be used. But if not, they just keep going and don't stop. And another point she made that ties into this, but kind of takes a different approach to it, is that adolescents are not like adults, and that adults are more likely to have sex on a regular basis when adolescents are not. So what she's saying is, if adolescents did have sex on a regular basis, they'd actually probably be more likely to prepare for it, in part by having condoms with them. But they don't, so they don't think of preparing for responsible sex as part of their general regular routine. And I know I wouldn't have thought about it that way, but when I think about it, I understand the point she's being made. This might also be why adolescents in their late teens are more likely to use various kinds of birth control than adolescents in their early teens, because in their late teens, they're having sex more regularly. Now, is this in part a lack of maturity, a lack of responsibility? Absolutely, 100% it is. Not acknowledging possible consequences, kind of feeling immune from the consequences. If you said to a teenager, if two people have sex and don't use birth control, what might happen? I have no doubt all of them, every single one would say the girl might wind up pregnant. It's not a complicated question. And when you look at the results of the study mentioned in the textbook, these demonstrate this point very well. So that as adults, we kind of shake our heads at them. The research in the text focused on low-income white and African American adolescents. And in it, one of the results indicates that girls did not have clear intentions about avoiding pregnancy. So if you said, do you want to get pregnant? They'd say, well, no. But at the same time, avoiding pregnancy was not something they were concerned about. And then combined with these, the research indicated that girls simply didn't realize how much of a lasting negative effect having a child as a teen would have on them for the rest of their life. And that's part of the reason behind this New York public health campaign that came out a few years ago. It received a lot of flack for not being completely politically correct, but at the same time, it's also very realistic. It's trying to get through to teenagers saying, look, this is what you're in for. So for girls in this study, they reported that they didn't want to become pregnant, and they knew that that would mean using birth control. They knew what they needed to do to avoid getting pregnant, but at the same time, didn't take definitive action to make sure they didn't get pregnant. And in addition, part of the problem is that when any discussion or decision about what would happen in a pregnancy did in fact occur, if it was unplanned, this didn't take place until after the girl was pregnant. So that in general, teens were not talking about a possible pregnancy before it occurred. And again, this demonstrates a lack of responsibility, not being very grown up. And I don't mean that to be insulting, it's a fact. When you look at teenage pregnancy rates in the chart in your textbook, notice that the US has one of the highest rates of teen pregnancy among developed countries. But the pregnancy rate here in Canada is half that, even though we know that rates of sexual activity for adolescents is almost the same. So we're two countries that border each other. We think that our youth are sexually active and at roughly the same rate. So why then are so many young people in the US getting pregnant? Um, well, and we could even get more specific. We have political differences, but generally our daily life, day in and day out, is pretty similar. We have pretty similar education systems. In general, at least on the surface, a 16-year-old in the US is raised in the same way as a 16-year-old in Canada. Now, one difference is that adolescents who are from low income families are less likely than other adolescents to use contraception. And the US has much higher rates of poverty than Canada does. And those are facts, not opinions. We know that the US has twice the teen pregnancy rate, and we know that coming from a low income family greatly increases the chances of a teen pregnancy. Now, what happens when teenagers get pregnant? Well, roughly 30% of unmarried teen pregnancies in America end in abortion. In Canada, abortion became legal in 1988. Now, it was technically legal since 1969, but you could only have an abortion if you were approved by a therapeutic abortion committee. So you'd have to request an abortion, put before the committee, which consisted of 3 physicians. And if these physicians determined there was a medically necessary reason for it, you would be approved, but only if there was a medical reason. It was in 1988 that abortion without committee approval became legal. Even so, abortion remains a really hot button issue for a lot of the population, especially in the US. Now, in Canada, we've always maintained much more of a clear division between church and state, whereas in the US, they don't do that. So, issues that we see as very clear cut are often viewed as religious and political issues all rolled into one in the States. More than half the states still require parental consent for a teen to have an abortion and or parental notification, where their parents have to at least be officially informed. And of course, this is going to have an effect on a teen's access to an abortion procedure. And whether parents have to be involved or not, this is not an easy decision and one that can have lasting emotional consequences for the girl involved. Approximately 14% of teen pregnancies end in miscarriage. And actually, spontaneous miscarriage is not terribly unusual, especially in first pregnancies. Of those unmarried teens that are pregnant and decide to go full term with the pregnancy, only about 5% put the child up for adoption, which means 95% are raised by their young mothers with or without the help of the young father. Keep in mind that an adolescent girl, dependent on her age, may also not be fully mature physically speaking, and because of this may have increased difficulties during delivery. So it's still overwhelmingly not considered positive when an unmarried teenage girl has a child, but at the same time, the stigma attached to it has declined significantly. It was not always like this. In the 50s and 60s, if a girl found out she was pregnant, in this time before abortion was illegal and in the face of such judgment, the solution was often to send her out of town for the pregnancy and birth and lie about where she was. And then when the baby was born, she would have no choice but to give it up for adoption because keeping it was simply not an option. She would be shamed and ridiculed, as would her family if she tried to keep the child. Even for her parents, some viewed a pregnant teenage daughter as a reflection of their lack of parenting skills. Oh, the parents mustn't have raised her right. Now, the boy would be reprimanded, but not surprisingly, he would not face the same level of judgment, which of course is another double standard. It's estimated that approximately 1.5 million infants were born to unwed mothers between 1945 and 1973, when abortion first became legal in the United States. Sometimes these homes are okay, uh, But for the most part, maternity homes that the girls were sent to were not terribly pleasant places to be. So the girls at these homes were often told not to share their last names with any of the other girls. Don't discuss your situation, don't discuss your pregnancy, don't discuss where you're from. And in some, they were not even called by name, but instead were given a number, just like they were in a prison. During labor and delivery, they were often by themselves. They would commonly be brought to a hospital and dropped off. It was not common for family to come and stay with them during that. So, by themselves, not a single person to stay with them, and first labors very commonly take 15 to 20 hours. Now, of course, the hospital would be aware of the situation, that this was a single, unmarried girl, and the child would be put up for adoption, and they would treat the girls accordingly. They would often deny them any opportunity to hold or sometimes even see the child. I was reading one account where the woman described how she could see the reflection of what was happening below her waist and the big round metal shade surrounding one of the lights. And when the nurse realized this, she moved the light so that she couldn't see it anymore. And when the child was born, they were expected to sign the papers and give their child up for adoption. Again, often being not even allowed to hold the baby. And if you research this in case after case, you'll read about being denied repeatedly the chance to see or hold the baby even once. So they'd say, well, the child needs medical attention, or you have to stay in bed, or you have a catheter so you can't get up. And sometimes the girls were even lied to in order to get them to sign the adoption papers. If a teenage girl became pregnant, another option was marriage. And I was fascinated reading in the text that according to one estimate, about half of the teenage American girls who married in the 50s were and 60s were pregnant on their wedding day. Think about that. 50%. And it's also sad, isn't it, that so many people were married when if they were living in a different time, they never would have considered it. So different than it is now when all of this is viewed so casually. So with all of this research that reports negative findings for the consequences for unmarried teenage girls, is there anything that shows us a positive outcome? Well, to sum up all the information provided in the text, which is backed up by the vast majority of research in this area, unfortunately, no. The vast majority of unmarried teenage mothers do not catch up with their peers in terms of their education or their occupation. Now, yes, there are always exceptions. I'm talking about the majority. And what about the young fathers? Of course, research focuses on the girls because they are the ones who physically have the baby. And even if they give the child up for adoption, they still carry the child for 9 months. So the direct effect of teen pregnancy is felt by the girl at the time and afterwards. So this is the focus of research. But we do know that boys who become fathers during their teenage years also have difficulty, and the majority tend to lag behind their peers in terms of education and occupation. They are also more likely to be divorced, and they're also more likely to abuse substances. Now, again, there's always exceptions. Boys who become fathers while still a teenager may not go through this, but we're talking about not just the majority, but the vast majority. In addition, boys who become fathers while still a teenager, are not likely to have a close relationship with the child. Where if you think back to those advertisements from the New York Public Health Campaign, one of the posters said, you know what, Mom? He's not likely to be here. So we can correctly summarize that for the majority of adolescents who become pregnant or impregnate somebody, the outcome for them is overwhelmingly difficult and negative. Some fare better than others, and of course, family support would have a great deal to do with this. Support in terms of being there to help, as well as the socioeconomic status of the family of origin of both teens, making it possible to help them financially. But the vast majority will face lifelong negative effects from becoming a parent as a teenager. Note that I am being specific here. This does not include a girl who has an abortion or has the child and places them for adoption. This usually refers to those adolescents who decide to keep and raise the child. And unfortunately, the child we're speaking about, a child of teenage parents, will also be much more likely to be faced with more difficulty, sometimes before they're even born. Especially in the US, where they do not have a universal health care system as we do in Canada, prenatal care can be sorely lacking for young mothers. And a lack of prenatal care for everybody, no matter what their age, is linked to low birth weight and a pregnancy not reaching the full term 9-month goal, both of which are linked to a wide range of developmental deficits for children. So it would make sense then that society as a whole would support sex education programs that provide adolescents with really concise, accurate information, not just about sexual activity, but their own body, how their development takes place, how to have a healthy relationship, as well as signs that a potential relationship is not the one for them. All of this. And you would think that at some point, if all of this information is provided to young people in a consistently increasing manner over the years, always suitable to their age, that at some point it would just click and we would see a drastic reduction in teen pregnancy, as well as a drastic reduction in sexually transmitted infections. Technically, this is referred to as comprehensive sexual education, or CSE. And what that means is that sexual education begins at an early age with age-appropriate topics about sexual development and sexual behavior. And as a student progresses and gets older, it would include easy access to birth control for students that chose to be sexually active. A much more extensive definition of exactly what comprehensive sexuality education is comes from UNESCO. And they say that it's a curriculum-based process of teaching and learning about the cognitive, emotional, physical, and social aspects of sexuality. It aims to equip children and young people with knowledge, skills, attitudes, and values that will empower them. Now, Denmark, Sweden, and the Netherlands are examples of countries that are very permissive in their attitudes towards sexual issues, including for adolescents, but their teen pregnancy rate and STI rate is very, very low because Denmark, Sweden, and the Netherlands have very comprehensive safe sex campaigns in the media. And young people are taught this from a very young age in school. And parents in these countries as a whole are pretty accepting of their children in late adolescence being sexually active. In America, the majority of people do support providing extensive sexual health education to young people. So again, sex ed that's age appropriate. You're not going to talk to adolescents who are 12 about the same things or in the same way you would talk to somebody who's 17. So this sex education should include information about pregnancy prevention and sexual transmitted infection prevention. And it would also include the benefits of abstinence. The majority of Americans support this kind of comprehensive sexual education. But the majority of Americans do not receive it, which is not good because the focus tends to be on promoting abstinence without clearly explaining contraception and how to use it effectively. Now, part of the difficulty is that sex ed is not standardized in the United States like a curriculum is. So there's plenty of room for individual states and individual school boards as well can choose what to include or exclude, even if they say they're offering sexual education. Now, I understand the debate here. On one side, you have parents and educators and others who strongly believe that by providing young people information about sexual development, and specifically information about contraceptive methods with instructions about how to use it, what you're essentially doing is giving them kind of subtle permission to be sexually active before marriage. You're encouraging sexual activity, whether that's your intention or not. So instead, they think sexual education programs should focus on encouraging abstinence and waiting longer. So don't have sex, don't have sex, don't have sex. On the other side, you have people who strongly believe that continuing to focus on abstinence is simply outdated and out of touch with today's youth, who are going to be sexually active whether they're provided accurate sexual information or not. So when you don't provide them easy access to methods of contraception, and you don't actually teach them how to use it, you're in denial about what today's adolescents are thinking about and what they're doing sexually. Believe it or not, fewer than 10% of American adolescents receive comprehensive sexual education by the time they leave high school. And that number just floored me. I never thought it would be really high. I thought it was like, maybe less than 50%, but I never thought it was that low. Only 21 states and the District of Columbia have mandatory sexual education, but 26 states have laws that mandate that abstinence should be stressed to adolescents. And in addition, the sex ed programs that are currently available and being taught, they just don't seem to have the desired effect. I think it's safe to say that if I asked you, what do you think an effective sex ed program would do? Well, it would reduce the number of sexually transmitted infections. It would reduce the number of pregnancies, and maybe even reduce the number of young people having sex casually. Well, that's not what the effect is. Instead, generally sex education, at least as it is now in the United States, has little effect on use of contraception, on the frequency of sexual intercourse for adolescents, or on how adolescents talk with their parents or their partners about contraception. So that's not good news, and clearly this needs to change. Now, in Ontario, we have further information regarding sexual education. In 2015, it was proposed that our sexual education curriculum be overhauled. Part of the reason for this was because it had not been overhauled since 1998, which is quite a long time, and a lot has happened in Canada in those years. In 2005, for example, same-sex marriage became legal in all of Canada. So with the way that society has progressed, in 2015, it was proposed that our sex ed curriculum be overhauled. And this really didn't go down very well.